Did you know that one of the greatest public health achievements of the 20th century is, in a strange way, a victim of its own success? It's a real head-scratcher, isn't it? Today, we're diving deep into childhood vaccination. We're not just looking at a medical shot, but at this complex mix of personal decisions, community health, and some truly tricky ethical questions.
Exactly. And for this deep dive, we've pulled from a pretty wide range of sources, everything from, detailed public health reports to the very frameworks of ethical decision making. Our mission today is really to cut through the noise, extract the most important insights, and help you understand the full landscape of vaccine decisions, turning complex info into, well, actionable understanding.
That's right. So our goal today is to dive into the real-world consequences of vaccination decisions, both the incredible benefits and, frankly, the serious risks when we don't act. We want to equip you with a clearer framework to understand the why behind public health policies, because it's a topic that's often, let's face it, oversimplified. Okay, let's unpack this. First, let's just acknowledge the sheer triumph that vaccines represent. Our sources are crystal clear. Vaccination is a top public health achievement of the 20th century. Can you maybe paint a picture of just how impactful that success has been?
Absolutely. I mean, we're talking about millions upon millions of lives saved and a significant increase in global life expectancy. Diseases that once just ravaged communities, things like polio or diphtheria, they're now largely confined to history books in many parts of the world. It's quite a remarkable legacy.
That's a fascinating paradox, then. It's this medical marvel, yet somehow it's become its own worst enemy. How can something so successful create such a profound vulnerability?
Well, it's what we often call victims of their own success. Because these devastating diseases are now so rare, many people today just haven't witnessed their historical burden firsthand. That lack of direct experience, it diminishes the perceived threat. It leads to this dangerous complacency about diseases we just don't regularly see anymore.
And now, our sources are describing what they call a perfect storm scenario brewing. We're seeing reduced vaccine coverage in many areas, healthcare systems that are already, frankly, overstretched from recent crises, and, social contact returning to pre-pandemic levels. It's a really concerning combination.
It truly is. And measles in particular is highlighted as the canary in the coal mine here. It's incredibly contagious, and its recent resurgence in many countries is a critical warning sign. If measles cases are spreading, it strongly indicates that other disease outbreaks could easily follow wherever those vaccination gaps exist.
Right. A warning bell. So we've seen the monumental wins and these silent threats. But what happens when that invisible shield falters? What are the immediate, undeniable costs when a child isn't vaccinated? Our sources reveal 7 really stark consequences that ripple through lives. Okay, here's where it gets really interesting.
Yeah, the first and probably the most immediate consequence is simply the increased likelihood of serious illness for your own children. Without that vaccination protection, children become highly susceptible to a whole range of vaccine-preventable diseases. Think hepatitis, tuberculosis, whooping cough, diphtheria.
And these aren't just, mild childhood ailments we're talking about. Take measles, for instance. Our sources show that for a child who contracts it, serious complications like severe diarrhea, pneumonia, even blindness and malnutrition are alarmingly common. These aren't temporary. They can have long-term, sometimes permanent effects.
Exactly. And secondly, there's a significant risk to other family members inside the household. An unvaccinated child who falls ill can easily become a direct source of infection for vulnerable individuals they live with.
That makes sense, doesn't it? You think about adults who are actually frequently the source of pertussis, that's whooping cough for infants. For babies who are too young to be fully vaccinated, this can be deadly. Or consider pregnant women. If they contract rubella, there's a high risk of congenital rubella syndrome, CRS, in the baby. That leads to serious, often lifelong disorders. And measles infection during pregnancy, it can even cause miscarriage. Just devastating.
Our third point is the contribution to broader community disease outbreaks. A cluster of cases among an unvaccinated or maybe undervaccinated group can quickly trigger a widespread problem. This can lead to the reemergence of diseases that were once really in decline or even thought to be eliminated in certain regions.
Yeah, and we've seen this play out in recent history, unfortunately. Sources cite a major measles outbreak in the Netherlands, over 2,700 cases, and 94% of those were in unvaccinated individuals, often due to specific religious beliefs. France reported a staggering 14,000 cases in a single outbreak, And in Ukraine, polio cases actually reappeared after vaccination coverage plummeted from like 91% down to a mere 15%. Tragically, in Afghanistan, cases of wild type 1 poliovirus, which is the most aggressive form, increased significantly because of an ongoing ban on vaccination campaigns by anti-government elements. That's a global threat, clearly. Fourth, there's the undeniable financial cost, bearing the burden of treatment and complications. These diseases carry a high economic price. For individuals, for families, and really for society as a whole, they often require expensive and time-consuming care. Yeah, to put that into perspective, diphtheria needs immediate hospital isolation and special costly drugs. An average measles illness. It can last up to 15 days, resulting in 5 or 6 missed days of work or school. That adds up. Adults with hepatitis might lose a whole month of work, and a baby born with congenital rubella syndrome can require lifelong, high-cost medical aid and therapy. These aren't just health costs, they're life costs, big time.
Fifth is the profound decrease in quality of life. Many vaccine-preventable diseases can lead to lifelong disabilities. Measles, for instance, can cause blindness. Polio can result in permanent paralysis or even death. These aren't conditions someone just recovers from. They can fundamentally alter a life forever.
And sixth, there's a real risk of decreasing life expectancy itself. Incomplete vaccination directly contributes to this trend. But on the flip side, our sources show that a significant increase in fully immunized children actually contributed to a noticeable rise in life expectancy in West Papua between 2010 and 2017. So the positive link is clear too.
Oh, absolutely. And looking historically, Brazil saw an astounding 30-year increase in life expectancy between 1940 and 1998. Now, this was primarily because of a dramatic reduction in deaths from vaccine-preventable infectious diseases. That collective protection, it extends far beyond the individual child. It literally shapes generations.
Wow. Finally, number 7. The practical implications, things like travel and school enrollment. Some countries now require full immunization status for visitors, and increasingly schools are listing complete immunization as an admission criterion. Why? Specifically to protect all students from vaccine-preventable diseases. It's no longer just a health issue in isolation, it's becoming a matter of access too.
So we've talked about the practical consequences, the sort of what happens. But this isn't just a medical issue, is it? There's this profound ethical dimension at play here that shapes absolutely everything. But what's fascinating here is how we can actually use the 4 core principles of biomedical ethics. Respect for autonomy, non-maleficence, beneficence, and justice as a crucial model for understanding the ethical dilemmas of vaccination at both the individual and societal levels.
Okay, let's start with respect for autonomy. If I'm understanding this correctly, this is basically about an individual's right to make decisions for themselves,
Right.
whether that's informed consent or informed refusal. And in the context of children, that usually falls to parents, right?
That's right. Parents decide for their children. But our sources also highlight the state's duty, known as parens patriae. It's Latin for parent of the country. Essentially, it's the government's role as legal protector of those unable to protect themselves, particularly children. Now, for a decision to be truly autonomous, several criteria must be met. The decision maker needs decision-making capacity. They need adequate disclosure of information and genuine understanding, which, by the way, is often compromised by misinformation, like that thoroughly debunked MMR autism link, and, crucially, voluntariness, meaning it's free from manipulation or coercion.
And this principle also extends to conscientious objection. Some parents object to vaccination on personal grounds, which can sometimes be recognized as non-medical exemptions. But this also raises the thorny question of medical personnel who might object to treating unvaccinated children, perhaps. And the ethical debate around where those limits actually lie, it's a really complex line to draw.
Indeed it is. The second principle is non-maleficence, commonly understood as first, do no harm. Now, while vaccines are incredibly safe, it's important to acknowledge they are not entirely without any risk. Mild adverse events like pain or fever at the injection site are common, and extremely rare severe ones like anaphylaxis or febrile seizures can occur, though they are very, very rare. Distinguishing these true rare contraindications from common misconceptions is absolutely crucial for ethical practice.
Right, and if non-maleficence is about avoiding harm, then beneficence, the third principle, is about actively doing good. Correct.
Precisely. And here's where vaccination offers a truly remarkable dual benefit. Direct protection for the individual, yes, absolutely. But crucially, also indirect protection through herd immunity. The real aha moment, though, for me at least, is recognizing this intriguing paradox. When herd immunity in a population is high, the direct, sort of selfish benefit of vaccinating a single child might seem less obvious, right? In that context, vaccination transcends just personal gain. It becomes an almost altruistic act, a quiet contribution for the greater good of the entire community.
That's a profound statement. Vaccination is an altruistic act. It really changes how you think about a simple needle stick, doesn't it? So then we move to the fourth principle, justice. What does that mean in this context?
Justice here means things like equal access to preventive measures and also an equal contribution to controlling communicable diseases. Our sources emphasize that herd immunity should really be recognized as a common good, something that is non-excludable and non-rival, much like clean air. We all benefit. It represents solidarity with vulnerable individuals who can't be vaccinated, like infants, the elderly, or those with specific medical conditions. But it also introduces the free rider problem, where individuals benefit from herd immunity without actually contributing to it themselves.
Ah, okay. So this is where the ethical justification for mandatory vaccination policies comes in, perhaps. Such policies are considered justified when, say, voluntary measures are inefficient, when there are no less coercive alternatives available, when there are clear scientific grounds, and crucially, when there's a real risk to others. So if I'm understanding this correctly, the ethical tightrope we're walking is between an individual's right to decide for themselves or their child and the state's responsibility to protect everyone, especially the most vulnerable among us.
Exactly. You can think of it a bit like traffic safety. We have laws for seatbelts and speed limits. Now, not wearing a seatbelt primarily endangers you, but speeding, that endangers everyone on the road. The state has a responsibility to protect public health and regulate individual behavior for the collective well-being, even if it involves something perceived as invasive, like vaccination. And finding this ethical equilibrium, that right balance between individual autonomy and public health, it's not constant, it's variable. It depends on the level of established herd immunity in the community, requiring constant reflection and adaptation.
Okay, so we understand this incredible, complex ethical framework. But what does this all mean when a parent actually walks into a doctor's office with questions, or perhaps some deep concerns? Let's try and bring these principles to life with a couple of real-world scenarios from our sources. Imagine our first scenario. A mother is hesitant about the MMR vaccine that's for measles, mumps, and rubella. She's heard from maybe clients or acquaintances that vaccination is linked to autism, or she has an anecdotal story about a child supposedly disabled because of a vaccine. Misinformation, that sadly is still pervasive despite being thoroughly, repeatedly debunked.
Right. In this vignette, the pediatrician's approach is really guided by all four principles we just discussed. For autonomy, the core issue is that the mother lacks adequate, reliable information. So the pediatrician's duty is to provide clear, understandable facts, directly address and refute those myths, like the MMR autism link, and reassure about vaccine safety that upholds beneficence and non-maleficence. Building trust and maintaining open dialogue are absolutely paramount here. And for justice, the conversation would naturally include explaining the community benefit of herd immunity, especially for highly contagious diseases like measles and, her responsibility perhaps to contribute to that protection.
Okay, now for a second, maybe more challenging vignette. A well-educated mother comes in. She states she's adequately informed herself and chooses not to vaccinate her 3-month-old. She believes there's no need because diseases are absent in the community currently, and she doesn't want to risk adverse events or even just the pain of a needle for her baby.
Yeah, this scenario highlights a direct conflict between that principle of autonomy and the principles of beneficence and justice. The pediatrician must first try to confirm the decision is truly autonomous and not unduly influenced by, say, controlling factors or misinformation she might not recognize. Strategies like motivational interviewing can be effective here, focusing on the parent's specific concerns and knowledge rather than taking a purely paternalistic approach. The pediatrician would gently, respectfully remind her about the potential reemergence of diseases, like life-threatening whooping cough in infants, and try to explain the altruistic nature of vaccination for collective protection. But, our sources note, when an autonomous decision poses a high risk to the child or the community, and all communication efforts fail, an external body, not the pediatrician themselves, might need to intervene. This is to preserve that crucial patient-doctor relationship. It's an incredibly difficult balance to strike.
Shifting our gaze now to the immediate past and looking towards the future, the COVID-19 pandemic really cast a long shadow over global health, didn't it? Significantly impacting childhood vaccination.
Indeed, it did. Pandemic lockdowns and widespread disruptions led to a sharp, frankly alarming decline in routine childhood vaccination uptake globally. Our sources show clear decreases in coverage for critical childhood vaccinations like MMR, measles, mumps, rubella, DTP, diphtheria, tetanus, pertussis, HPV, human papillomavirus, MenACWY, meningococcal, And DDOPV, tetanus, diphtheria, polio, among others, it was a significant setback.
And what's really concerning is the trend we've observed since then. Initial drops in disease cases during the height of social distancing, which makes sense, but then the subsequent surge in vaccine-preventable diseases like RSV, norovirus, and pneumococcal disease as restrictions eased. It's like it created this dangerous immunity gap.
Exactly. And without significant catch-up efforts, predictions from our sources indicate a projected increase in measles and polio deaths, unfortunately. The ground we gained over decades is seriously at risk of being lost if we don't act decisively.
And vaccine hesitancy itself seemed to be exacerbated by the pandemic, right? Concerns about the speed of vaccine development, maybe a general distrust in authorities, and the just widespread proliferation of misinformation and conspiracy theories on social media played a huge role. As one source chillingly put it, misinformation is a vector of disease. It's shocking. But even that infamous MMR autism myth, despite being thoroughly debunked decades ago, continues to influence parents globally. Still.
Addressing this requires a really multifaceted approach. Our sources point to the 3Cs model, which is a powerful framework for understanding and tackling vaccine hesitancy. Maximizing convenience of access, minimizing complacency by clearly communicating disease risks, and building confidence in vaccines and the health systems delivering them. Strategies like inoculation or pre-bunking misinformation, basically exposing people to small amounts of false information beforehand to build critical assessment skills, are proving vital. And of course, organizations like the WHO and UNICEF play an absolutely crucial role in promoting accurate, trustworthy information.
Expert, let's just cast our minds back for a second. What would happen if we just stopped vaccinations altogether? Our sources paint a truly devastating picture. Can you give us a glimpse into that pre-vaccine world we've worked so incredibly hard to leave behind?
Oh, it would be catastrophic, truly. Before the polio vaccine, we saw 13,000 to 20,000 paralytic cases annually in the U.S. alone. Measles, once responsible for about 450 deaths a year, would surge again. Haemophilus influenza type B meningitis, or HIB, which caused 20,000 cases and 600 deaths annually, mostly in young children, would be back. We'd see whooping cough potentially hitting up to 260,000 cases, 9,000 deaths, diphtheria, rubella leading to congenital rubella syndrome in perhaps 20,000 infants, 11,000 miscarriages, varicella or chickenpox causing 4 million cases, 150 deaths, hepatitis B, tetanus, mumps, all reverting to their devastating pre-vaccine era prevalence. This would mean immense suffering, widespread lifelong disability, and thousands, if not millions, of preventable deaths each year globally. It's a world we simply cannot afford to return to. Hashtag tag outro outro.
So we've journeyed from the direct, tangible consequences of not vaccinating, through those intricate ethical considerations that guide public health policy, to the urgent lessons learned from global pandemics and the persistent damaging challenge of misinformation.
And what becomes overwhelmingly clear, I think, is that herd immunity is not just some abstract medical concept. It's a precious common good. It benefits everyone, especially the most vulnerable members of our society. And vaccination, in many ways, is often a profound act of altruism, a quiet contribution to this unseen shield that protects us all.
So what does this all mean for you? How do we as a society continually find that ethical equilibrium between individual autonomy and our collective responsibility to protect common goods like herd immunity, especially in this era of global travel and pervasive online information? What role do you play in upholding this invisible shield for our communities? This isn't just a medical discussion, is it? It's a fundamental societal challenge that impacts every single one of us.